We've done mass vaccines.
This isn't the U.S.'s first rodeo for vaccine distribution.
As a kid, I can remember everyone lining up and getting polio vaccines.
And helping with the COVID-19 vaccine distribution plan is Dr. Janice Orlowski, the Chief Healthcare Officer for the Association of American Medical Colleges. But her two main concerns about the vaccines don't actually have to do with the science, but the logistics.
I think the fact that we have to do a second shot is a big deal.
For both the Pfizer and Moderna vaccine to be properly inoculated, you'll have to get 2 shots around 3 to 4 weeks apart.
Can I find you? Are you there? What happens if you don't show up in 30 days, but you show up in 45? Do you just get one more shot, or do we have to do it all over again?
But scientists won't know the answer to that until they're in that situation after vaccines are out and administered, something that is Orlowski's other concern, especially with the Pfizer vaccine, which must be stored in ultra-cold -80-degree freezers.
Not everyone has the freezers.
These freezers are different than the ones we store food in at home. Freezers that store vaccines have to be the same exact temperature throughout the entire unit.
Your vaccine might be on the top shelf, the one I get might be on the bottom shelf. Each one has to be within that temperature range, or we have a problem.
The demand for these specific ultra-cold freezers has gone up substantially, something Thermo Fisher Scientific, PHC, and Lab Rep Co., who specialize in this equipment, told us.
We've been planning for this from, a global perspective.
What used to be 10, 15, 20 a day is now 50, 70, 100 a day, sometimes more.
Every state had to make a plan on where the vaccines will initially go.
And that plan was due to the CDC a couple of weeks ago. And so the state's health departments worked with our institutions to see where they could have this cold storage.
You're going to need a lot more freezers than a state that might have a lesser population. It's all about the numbers.
So what's California's plan? The California Department of Health identified these facilities throughout California for initial vaccine storage and distribution. In our neck of the woods, UC Davis said they currently have 3 freezers on site which are able to store the Pfizer vaccine, with 2 more ordered and on the way. Right now, they have the ability to store around 150,000 vaccines. But as the vaccine continues to be distributed, other hospitals and schools with ultra-cold freezers are expected to be tapped upon.
Fertility units have, that kind of storage. And there's some biotech companies that have it, but predominantly it's the research institutions that have it.
We reached out to all medical schools throughout California. In addition to UC Davis, UC Riverside, UCLA, UCSF, USC, and Loma Linda all have ultra-cold freezers and said they're ready for vaccine storage if needed. And if and when the Moderna vaccine is approved, it'll ease up refrigerator specifications, as it only has to be held in a -20 freezer, something more common than the -80 equipment.